This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. Lafredo, and this week I'm coming to you from KRMC's Wallapai Mountain campus. My guest is Dr. Michael Vieira. He's a new pediatrician at Joshua Tree Pediatrics at KRMC. Dr. Vieira, welcome.
Thank you. Thank you for having me.
Yeah, thanks for joining me. You're new to the program, of course, and you're new to KRMC. When did you start here?
I started just about 2 weeks ago, so I'm still getting the hang of the new office and everything, but so far everything's going great.
Yeah, brand new, right?
Right, yeah.
2 weeks in the office so far, and how long have you been in Kingman?
About 3 weeks, so I'm also new to town.
Wow.
Yeah.
So tell me about I want to get into your work and your specialties, but if it's okay with you, I think a good place to begin is a little getting to know you. That's all right?
Sure, that would be great.
Yeah, so tell me I'm dying to know about your experience so far in Kingman.
So far, I've been really enjoying myself. Like, the weather is great. I'm from New York, where it's very cold. So here, I actually prefer the weather a lot here as compared to there. And everyone's been very friendly, especially, at work, but also just around town. Everyone really has that small town feel.
Yeah.
And, I'm really enjoying myself so far.
And where in New York do you come from?
I'm from Westchester County. It's just the suburbs of New York City to the north, like outside the Bronx.
Yes. I grew up in Western New York. It's a totally different world. It's more like farm country compared to where you grew up, but south of Buffalo, out there in the sticks.
That's nice.
But when you talk about the weather out here, I can sure relate to that. I remember those long winters. You won't miss digging yourself out of your parking spot every morning?
No, that's one of the things that I really dreaded was, shoveling snow. Every time there was precipitation, there's snow, and we were right by the ocean, so it seemed like at least once a week I was shoveling out of my driveway.
All the time, right?
Yeah.
So how does a young doctor from New York find his way out to Kingman, Arizona? What was the appeal for you?
So for me, I liked the small town appeal. I liked how patients get to know you, and then they come to trust you, and you can become like a local pediatrician and really make a difference in a small town, as opposed to like New York, where there's so many people and so many doctors, so you kind of just get lost with the shuffle, I thought, a little bit.
When you were training there in New York, did you feel like you had much of an opportunity to establish relationships with patients and families, or not as much?
I did. I was working in the underserved community in Brooklyn, like inner city Brooklyn, and we did have like a continuity clinic where patients would come see me weekly, but of course it was just 3 years, so I couldn't really get like a full spectrum of like newborn to adolescence. But yeah, that was one of the things that I really enjoyed about primary care and pediatrics was the continuity of care, and I feel like I can definitely establish a nice practice here and continue to do that.
Yeah. It's interesting you mentioned an underserved area in New York City, right? Because there are so many doctors and so many specialists there, and yet there are communities and areas that don't get the coverage they need, it sounds like.
Definitely. Like, I was in Flatbush, Brooklyn, and it's definitely like medically underserved, and a lot of patients who might not have access to all the resources, but this is the kind of population that I really take pride in treating, and honestly, I feel like that's my calling, helping underserved patients, so I think I can continue to do that here.
What is it about that? What is it? You said it's a calling, right? It's not just a job. What is it that moves you about that?
So for me, I just believe in patient equality, and it doesn't matter how much money you have. You really should have access to good medical care, and it's just something that I believe in and strongly, and something that drives me to show up to work every day and help people, no matter what their background is.
Was that something that you felt? Well, let me build into that question. What led you to a career in medicine?
So I've always been interested in helping people. And, I've always been good at science, so it kind of was just like a logical thing. I did well in my pre-med classes, and I was volunteering at a hospital in New York, and I just took like a lot of pride from helping people and the satisfaction when they get better, and you feel like you played a part in that, and it was just a good career choice for me.
So if we could have talked to the 15 or 16-year-old version of you, would you have known already at that point that you wanted to be a doctor?
I think, I had like lots of hopes and dreams, like hopefully like my adolescent patients would have. Like, I think at some point I wanted to be like a fighter pilot,
Sure,
but,
yeah.
My vision's not so great. And
Not a baseball star or anything like that?
well, I was never really like so great at sports, but it was also interesting. I was on like the Little League baseball team. And, but yeah, I had like lots of hopes and dreams, but I think definitely I wouldn't be surprised if you told me I was going to end up being a doctor, because I always liked helping people. So I feel like, yeah, like the healthcare field was a good fit for me.
Almost
definitely.
as good as being a fighter pilot.
Yeah, maybe.
So you went to medical school. When you were entering medical school, had you already kind of zeroed in on pediatrics, or was that something you discovered along the way?
Actually, I kind of discovered it along the way. I was trying to keep an open mind. I wasn't sure if I wanted to be like a surgeon or like a family medicine doctor, like primary care, but I always really liked primary care. So when I started working with children in my pediatrics rotation, I found it like very rewarding. And of course, the kids are very nice and smiling, laughing. They make you feel like you fit in. They're non-confrontational most of the time and everything. So I really enjoyed pediatrics. It was really rewarding for me. So once I did a few pediatrics rotations, I felt like that was a specialty for me.
Yeah, of course, when you're in medical school, they give you rotations in all different areas of medicine, and they try to give you a taste of everything. And there are some things probably that you walk into, and shortly thereafter you say, ooh, this is not for me, right?
That's right. So it's just kind of process of elimination and going with the flow and making sure you pass your rotations. And yeah, like zeroing in on what you want to spend your career and your life's work to do.
Yeah. Were there any specific instances, or do you remember a moment where you said, oh, peds, this feels like home?
Sure. I mean, I had lots of good cases when I was still a student, especially with like underserved patients. They maybe hadn't seen a doctor in a long time. And, just making even like a simple diagnosis, checking the ears and seeing that something was wrong that maybe had been bothering them. And even, small children, sometimes they can't verbalize what is wrong. So, even just doing a basic physical exam, you can really help someone if you catch a problem. So yeah, like certain instances like that where I made a difference and I felt like, oh, this could be good for me.
Well, we said you're working at Joshua Tree Pediatrics. I know some people over there. It's a pretty good place. I think if this were a political show, I'd have to say, in the interest of disclosure, you're working with my wife, Dr. Leanna Lafredo. And so thank you. I'm glad you're there to help with the workload, because I know they stay busy. Have you found it pretty busy, pretty hectic so far?
So far, they definitely have a busy schedule, but Dr. Lafredo's been a great colleague for me, easing me in and showing me like the ropes and the system and everything. And I'm slowly getting the hang of things, and I'm just a few weeks in, but I'm enjoying myself, and I'm looking forward to maybe even getting more busy in the future.
Yeah, I was not fishing for a compliment, but thank you. I'm glad to hear that it's been good for you
you're
so
welcome.
far. A moment ago, you were saying about working with young patients, working with kids, and a lot of them they're pre-verbal, they're smiling, they're happy, right? And I know from just stories from my wife and her colleagues over the years. I mean, I know that they feel the same way. There's something special about that patient population. But I also know that at times you have to deal with some sad stories. You see pediatric cancers, you see leukemia, you see things like that, and sometimes the kids recover, sometimes they don't. What is that like when you have to work with a patient who's in difficult circumstances like that?
Of course, it's very hard when a child is sick. Children are not supposed to die. It's the older adults that are supposed to die, like when they get to that age. But children get sick just like adults, and in rare circumstances, they can have very dangerous diseases like cancer, like you mentioned. And it's sad for everyone. Sometimes there's nothing really you can say to make things better. Just be a good listener and do your best to try to comfort the family and the patient. And I would say, comfort care measures and being a good listener, doing your best in the situation, and making sure that the proper health care is provided.
Yeah. Yeah, I imagine, especially when you're learning the job, when you're training and you're experiencing that stuff for the first time, you've got to take those home with you, right? You probably wear those cases for a while where they weigh on you.
Yeah, absolutely. I did a rotation in pediatric oncology at Memorial Sloan Kettering in Manhattan, so there was all kinds of rare terminal diseases there. And those cases still stay with me, but I believe they were good training for me and something that I could hopefully bring some compassion to the people of Kingman and things that rubbed off on me in that rotation.
Yeah.
So, yeah.
Well, the other part about doing a residency is that they work you to utter exhaustion, right?
Yes.
You don't sleep. It's like get up, get on your feet, get in there again, get in there again. And you get better because you have to know everything and you have to right? I mean, certainly you're making mistakes along the way and you're working with people who can show you the way, but they just crush you with information over the course of a few years, right?
Absolutely, and it's a very intense and rigorous program, but it's made me the doctor that I am today, giving me confidence that I can take care of complicated cases, complex patients, and also, just establishing routine care, preventative care, preventing bad things from happening, like dangerous rare diseases through the use of routine vaccination. Mm-hmm. And so of course it was rigorous, but I think maybe it's by design, to make you a good doctor in the end.
It's time for a quick break on Focus on Your Health. We'll be back in a moment for more with Dr. Michael Vieira. Stick around. Welcome back to Focus on Your Health. I'm T.G. Lafredo, and this week on the program, my guest is Dr. Michael Vieira. He's a pediatrician at Joshua Tree Pediatrics at KRMC. Let's talk about some of those preventive measures, the things that you like to instill in young patients, and also a fair amount of the work you do is educating parents and trying to help kind of guide them on the right paths with their kids, right?
Absolutely. I like to have the parents on my team, hopefully, and we feel like we're all a team working together for the betterment of the child. Things like routine vaccinations are extremely important. I know even the COVID vaccine now recently was FDA approved for 5-year-olds up to 11. Previously, it was just 12 and older. So, and COVID's a very dangerous disease, and it's just one of many examples of vaccines that can help save children's lives. And another thing that's very important is developmental screening, making sure if there's any delay in communication or social interaction or, walking on time, talking on time, if there's any delay, that we can catch it early and provide the services that the child needs. And these things have been proven to result in better outcomes.
Sure. I want to talk about vaccines. We've talked a lot on the program over the years about vaccines. And you take a drink of water and brace yourself for it. Well, I mean, here's the thing. There's a huge body of scientific evidence. There shouldn't be any doubt about the efficacy and importance of vaccines. I'm assuming some part of your job is trying to keep the facts straight for people and steer them to the reliable and credible sources.
Absolutely. I know there can be some hesitancy from some parents about getting their child vaccinated and on time. From my experience, vaccines have been extremely safe and effective. Things like our inpatient pediatric ward sometimes only has maybe one patient or no patients because things like meningitis have been prevented using routine vaccination. So I really believe that it's very safe and effective. And of course, I always try to convey that to the parents and do my best.
I remember speaking with an older doctor who had trained in India. And as I said, he was an older gentleman, so he came from a different time in a part of the world, certainly where there was far less medical care. And we were talking about the importance of vaccines, and he said when he was a young guy training, he had to go into these polio wards where these young people, many of them would never make it out. And the ones who did, many of them were, just had severe handicaps for the rest of their lives. And so again, speaking of the importance of vaccinations, he said, we forget because life has gotten a lot safer here in the U.S. But he saw that firsthand, and he just like always wants to impress upon patients and parents how important that is.
Definitely, I would 100% agree. And speaking of pandemics, we're dealing with a COVID pandemic now. And in New York, when I was working as a resident, it was kind of just the height of the pandemic. And I just saw firsthand how dangerous that disease can be. And I'm very grateful that there are scientists working on vaccines and trying to make everyone's life safer, honestly. So I would encourage the people of Kingman to vaccinate yourselves and your children.
If they have questions, what are good areas of research or good sources you would point them to?
I would say start with the CDC website, cdc.gov. And go from there. I mean, that's what I use as a resource, and it's a very trustworthy government body that really says the facts.
Mm-hmm. If you're just joining us, this is Focus on Your Health. I'm T.G. Lafredo, and my guest is Dr. Michael Vieira. He's a pediatrician at Joshua Tree Pediatrics at KRMC. Dr. Vieira, you said that you were training in New York really during the height of the pandemic. I remember seeing the news of the refrigerator trucks, and they were taking the bodies out, and it really hit the city like a blizzard. And I remember the stories about the people from the residences applauding the doctors and nurses at shift change. What were some of your experiences when you were there at that time?
Well, it was just kind of a once-in-a-lifetime experience, probably something that other residents wouldn't see for a long time, I hope at least. Yeah. It was very busy times in the hospital. I was seeing adults even though I was training as a pediatrician, just because of so many patients and not enough doctors to go around. Everyone tried to stick together and be as positive as they could be, even in like grueling hours and, dangerous working conditions with the extremely contagious virus seems like affecting everyone around you. So, and they would give us like free meals, and everyone would give us encouragement. So, I got through it, and I felt like I made a difference in people's lives and helped people working those kind of grueling night shifts.
Yeah.
So
it was all hands on deck.
Exactly.
Did you have colleagues who got sick, or maybe worse, maybe passed from it, or was it pretty safe, or was it relatively safe where you were?
Definitely some people I know got COVID, but as far as I know, no like fatalities or anything, but you had to be extremely careful. I mean, if you dropped your mask on the ground, the whole hospital was just crawling with it. So.
Yeah. I remember stories filtering in from where my wife had trained in the Philippines, the University of the Philippines, and we heard about some of her colleagues and some of her former professors who got sick and indeed died from COVID. One of them was seeing a patient who had a different chief complaint, which I know you see that sometimes. Patients come in with one complaint, and then right toward the end, it's, and then there's this other thing.
That's right.
With the case of this particular doctor and that patient, the other thing was COVID, and he didn't mention it. And that doc got sick, and it eventually cost him his life. It's a tough job.
Yes, and I know there was some adult doctors that I hadn't met, but were like legends of the hospital that passed from COVID during that time. So, It's part of the job. We come in contact with dangerous diseases, but the point is that we do our best to help you to recover, and it's very rewarding when people can make a full recovery.
Let's move on to a little bit happier, brighter topic, shall we? Pediatrics covers such a huge age range. You see patients who are just born all the way up to patients who maybe have started college and are, for all intents and purposes, they're adults. And so much happens in the life of a human being from one point to another, and the needs and the requirements for taking care of those patients. What is that? So what are the challenges in that for you, and what are the rewards?
So some of the challenges would be that different patients have different needs, especially when they switch from one age group to the other. You really have to be on your game. What are you looking for? What vaccines does this patient need? And things that you don't want to miss.
Yeah.
That's my job as a primary care pediatrician if there's sometimes just the littlest problem, if you don't catch it, it can go on to be a major problem.
Yeah.
And there's different kind of age groups that you kind of keep your mind, but always you have to be on your toes.
Sure.
And figure out what's best for the patient and how can you help.
Yeah. I know that, if you stay in one place long enough, you'll see a child as a newborn, and then seemingly before too long, that child is coming in with some very adult kind of concerns, and you'll say, how did this happen, right? Probably the same thing the parents ask.
That's right. And sometimes, as a new sibling is born, they come to you too. So sometimes you see a few siblings in the same visit. So you can really take care of the whole family, and everyone seems to be in a different age group. But it's a great field. It's very rewarding and very nice. Yeah.
Yeah. And it sounds like you're ready to establish those relationships with the people here in Kingman.
Absolutely. I'm here to serve the community and hopefully make a difference and promote good health care for the people of Kingman. And that's my mission, and I'm very excited. You are
accepting new patients now, right?
I am currently accepting new patients, and I would be delighted if you would bring your child to come see me.
And you can schedule an appointment with Dr. Vieira if you call Joshua Tree Pediatrics. That number is 928-681-8706. That's 928-681-8706. Well, Doc, in the few minutes that we have left, I want to ask you, I was writing up some questions before we got together, and I thought, well, gee, this really sounds like an interview question, but I want to ask you anyway. You finished your training, you're here, you're ready to dig in Kingman. And when you think about the next few years ahead of you in your career, what do you hope to bring to the people of Kingman and to KRMC?
Well, in the next few years and beyond, I hope to establish a trustworthy presence in Kingman and to make a difference and help people and do my part as a physician to promote good health care and scientific discoveries as they come. Of course, medicine is always changing, so I hope that I can stay up to date with everything and relay that down to the front lines with my patients to make a difference and make sure everything stays right at the forefront of medicine and science, and make a difference in people's lives, medically and also just with counseling and comforting and being a good listener to new patients and hopefully making them feel comfortable.
That is Dr. Michael Vieira. He is a pediatrician at Joshua Tree Pediatrics at KRMC, and you can reach his office at 928-681-8706. That's 681-8706. Dr. Vieira, welcome to KRMC, and thanks so much for your time today.
Thank you so much for having me. I really enjoyed it.
And that is the program. That's Focus on Your Health. I'm TG Lafredo. Thanks so much for listening. We'll catch you next time.